You know, on several occasions we've visited Coastal Family Health over in Biloxi. Well, they have several locations along the Gulf Coast, but so we decided to kind of branch out a little bit and introduce you to some of the other locations. So today we're actually at the Coastal Family Health location here on Amoco in Moss Point. And Hoyt Williamson, nurse practitioner. How are you?
Very good. How are you?
It's very nice to meet you. Tell us a little bit about yourself, if you would, and what's going on here.
I'm a family nurse practitioner. I have over 10 years experience in the medical field. I've been at Coastal here for a little over a year. I've been here at Moss Point since earlier this year.
Okay. Now, Coastal Family Health is known for the work that they do and helping people of all ages. You know, we've been to the pediatric center over in Biloxi, as well as the adult center. Here in Moss Point, you cater mainly towards adults and seniors.
Yes, I do see patients basically from infancy into late adulthood, senior adulthood, but the majority of my patients are those adults aged 18 to 65. Okay. Most of those with chronic conditions like diabetes and hypertension and high cholesterol.
Now that's something that you see a lot down here. I mean, yes. Mississippi, #1 yes. in the states for type 2 diabetes.
Certainly. This area is quite burdened with diabetes, and unfortunately, like you said, diabetes, Mississippi is leading the nation. Over 15% of our adults have diabetes.
Well, I hate to say it, Doc, but we like to eat in the South.
Yeah.
And so.
Yeah. And that is, yes, you're right.
Exactly. Now, besides that, I mean, you deal a lot with diabetes, and I believe you were telling me hepatitis C?
Hepatitis C, yes. We've recently received a green light and the necessary training to start treating hepatitis C in the primary care setting. Mm-hmm. The therapies are where they are now, that the treatments are much better tolerated, they're much safer, and they're much more effective. Some of the drugs boast a cure rate, essentially a cure rate of over 99%. Mm-hmm.
What age group do you see a lot of hepatitis C in?
So, #1 risk factor is baby boomer status, those born between...
I was going to say, and you see the commercials on TV all the time, you know, that if you're born between...
1945 and 1965.
Okay, yeah. and I fall in that area.
Sure.
Fortunately, I've been tested, and I'm clear.
Yeah, everyone that born between those years is encouraged to be screened. It's also associated strongly with HIV infections, so those patients would be screened, and in the younger population, it's most strongly associated with IV drug abuse, sharing of needles, stuff like that. So if any of that fits anybody, we'll be glad to screen them.
You don't hear a lot in the news anymore about problems of HIV, things like that. Has it kind of hit a plateau as far as the number of people that have contracted that?
Yeah, as far as the last that I checked, it was kind of plateauing. The treatments are where they are now, where people are living much longer with it. So it's they essentially can lead a normal life if they're taking a medicine for it.
Well, let's jump back to hepatitis C. What are perhaps some of the symptoms that someone may have if they may be wondering, maybe I have it, or I have this symptom, maybe I should go get it checked?
Well, hepatitis C is a virus that causes a few different clinical illnesses. What we most often see is a chronic infection that over many years produces changes in the liver, scarring the liver, similar to alcoholic cirrhosis. Mm-hmm. It's really kind of a silent thing. People can get really ill on it, or they can just kind of have this chronic smoldering infection that's causing those changes. It can lead to even liver failure, which is an awful malady, and it's also associated with increased risk for liver cancer. Mm-hmm. So we really look at risk factors because there's not a lot of symptoms, and screen anybody that falls within those. So
the best thing to do is just to be on the safe side. Mm-hmm. I mean, you come in for a checkup, and get tested for it. I guess it's a simple blood test.
Yes, that's correct.
Now, what are some of the other issues that you deal with here at Coastal Family Health in Moss Point?
We see acute complaints, colds. We have our flu vaccination season is in, so we do all kind of acute care type visits.
Common colds.
Oh yes, all the time. And we also deal a lot with other things like hypertension and high cholesterol.
High blood pressure, hypertension. You don't do any kind of surgeries or anything?
No, we do simple procedures, like if somebody has an abscess or something that needs to be.
I come up here with this deep cut in my finger. You can sew it up.
Probably in the hand, we would probably refer you to the ER.
Yeah.
But other simple lacerations, we're comfortable doing.
Now, what coverage of area? I mean, pretty much anybody that lives, I guess, in Jackson County
Yes.
that qualifies.
Yes. Well, part of the of Coastal's mission statement is to provide quality health care to all individuals. So, and our footprint is such that we can really meet these health issues because we have many different locations. Moss Point here in Jackson County, there's Van Cleve, there's a couple of rural clinics up in Greene County at Leakesville and the state line, and then one's further down along the coast. So
Biloxi, you got one in Bay St. Louis as well.
Bay St. Louis,
yeah.
and yes, sir.
So anybody that they feel they need an issue or have a cold, they don't have a regular practitioner. I guess they just call and make an appointment.
Yes, and what's great about us, we're a federally qualified community health center, which means that we have resources arranged so that we can see uninsured patients, and that's a big part of our philosophy.
And a lot of people don't have insurance.
Yes,
even with the Obamacare out there and the other things, they still maybe cannot afford it.
Yes, and some providers might not take Obamacare or they might not take Medicaid, and we see those gladly. So.
Now, I guess what as far as getting in here, they need to make an appointment with you?
Yes.
You take walk-ins?
Yes, we do have several slots available usually for walk-in appointments.
During the day?
Yes, sir.
And you open 6 days a week, 7 days a week?
Here at Moss Point, we're open 5 days a week, Monday through Friday. We have extended hours, each one of those, each night. On Mondays and Wednesdays, we're open till 7, and then Tuesday through Friday, I'm here till 6.
Okay. Any last-minute health tip that you can give to anybody?
It is flu season, so we have vaccinations, and we're ready to get people vaccinated because we don't want them to have the flu.
No, there you go, because goes with the winters, of course. What winters do we really have down here? I mean, one day it's 40 degrees, the next day it's like 80. So
it's kind
what
of
can I
bipolar,
say?
yeah.
Hoyt, thank you so much.
Yes, sir.
I appreciate it.
Thank
you for letting us come in here and visit you at Moss Point.
Certainly, I appreciate it.
All right, they're located here on Amico. If you come off of I-10 and go south at the Moss Point exit, first red light you come to,
Yes.
you take a right, and you go right past the hotel there on your left-hand side, and you'll see it, Coastal Family Health.